Mental health experts are saying we'll see an increase as a result of this in depression and the like. You agree?
So, Larry, already we're seeing figures that up to 80% of the American population is already depressed and showing signs of depression. So, listen, it's a terrible era. For a lot of people are really concerned. You have an increase in suicides, you have an increase in domestic violence, you have an increase in drug abuse. All of this because people are desperate. I mean, there is no way for many people who are in service industries to earn any money. The money's going to go away from the government. Unemployment's going to run out. So there's lots and lots to worry about. On the one hand, it's great to be able to drop the overall number of cases and keep it below what the healthcare system can manage. But on the other hand, you are seeing increased numbers of deaths from other illnesses. People are afraid to go into ERs. They're going into ERs, 48 hours after they've had a heart attack. The violence, the drug abuse, the alcoholism, all of that is going to, basically cause a tremendous amount of turmoil and may cause as many or more deaths as the epidemic itself. It causes many or more deaths as the epidemic itself. It causes many or more deaths as the epidemic itself. It causes many or more deaths as the epidemic itself. It causes many or more deaths as the epidemic itself.
You just heard Dr. Bob Arnott talk about how the mental issues during lockdown have increased drug use, increased, as he ultimately said there, increased suicides, more deaths by problems within the lockdown than the actual COVID-19. A year's worth of suicide attempts in 4 weeks, the consequence of COVID-19 lockdowns. Amazing, amazing stuff. An ABC affiliate in California reports that doctors at John Muir Medical Center tell them they have seen more deaths by suicide than COVID-19 during the quarantine. Do I need to repeat that? Tell them they have seen more deaths by suicide than COVID-19 during the quarantine. Didn't I report something similar about that recently? About there's more deaths of suicide in our military than actual guys dying in combat? The numbers are unprecedented, said Dr. Michael, referring to a spike in suicides. We've never seen numbers like this in such short periods of time, the doctor added. I meant we've seen a year's worth of suicide attempts in the last 4 weeks because it's getting to people. It's building up the tension, the anxiety. Okay, a trauma nurse who has spent 33 years at the hospital said she has never witnessed self-inflicted attacks on such scales. Okay, I have never seen so much intentional injury. Yeah, you're locking up, wild animals. There are little evidence that lockdowns have reduced the spread of COVID-19. Even if there are compelling evidence that lockdowns were saving lives, it would be a mistake to ignore the manifold unintended consequences. Oh, geez, I just love their use of that word, unintended consequences. Okay, in sociology, we call those latent effects or dysfunctions. Latent effects are anticipated side effects of any given type of social delivery program. And dysfunctions are the unanticipated side effects. But see, this is a latent effect. You know damn well locking people up is going to cause big problems. Once again, unintended consequences, okay? Every human action has both intended, which are known side effects, and unintended side effects, which are latent effects or dysfunctions. Okay, the problem, negative unintended consequences, is twofold. See, there's that word again, unintended consequences. This is like calling fascism corporatism or globalism. It's trying to put lipstick on a pig. Okay, this is just pure, horrible type of stuff. Once again, unintended consequences. God, they're using that word a lot. Unintended consequences. Why are they drumming that in our heads here? Intended consequences than unintended ones. There we go again. That word is being thrown out around. Unintended consequences of the COVID-19 have been severe. Of course they have. And it was all planned that way. They knew this was going to happen. They knew the human being can't be caged up like an animal. The psychological and physiological intended consequences, unintended consequences of stay-at-home orders have received less attention. Of course it has, because they don't want this kind of stuff out. And just as Dr. Arnott says, Wall Street Journal report shows a surge in the number of people taking drugs for anxiety, insomnia, prompting physicians to warn about long-term risk of increased prescriptions, which include drug addiction and abuse. Well, the pharmacies love that. They are part of this problem. They are the big part of this problem, along with Bill Gates. Okay, here's a New York Times article here. Individuals with less social connection have disrupted sleep patterns, altered immune systems, more inflammation, and higher levels of stress hormones. One recent study found that isolated increases the risk of heart disease by 29% and stroke by 32%. Okay, I'm going to come down here with the kids because I'm very always concerned about our kids in the world. Even the ones we're murdering in Libya, Syria, Iraq, Iran, all them kind of places, Palestine. Loneliness can accelerate cognitive decline in older adults, and isolate individuals are twice as likely to die prematurely, which has been happening in all of these people's lockdown houses, as those with more robust social interactions. These effects start early. Social isolated children have significantly poor health. Socially isolated children have significantly poor health 20 years later than after controlling for other factors. All told, loneliness as an important risk factor for early death as obesity and smoking. But nobody cares. Once again, 22 veterans kill themselves every day. Now I wonder if the stats of that have been increased to maybe 24, 25, maybe 30 a day, but we don't know. And I always keep saying, what about the ones who wish they were dead? That's probably tenfold. And once again, more guys, more of our soldiers are dying with suicide, as a report I did a few months ago, are dying from suicide than in actual combat. Da-da, where's all the reports on that, huh? Report surges in calls to suicide hotline. Okay, you get the idea what's going on here? Hey, more people are dying by suicide than the actual virus, but nobody's talking about it. The Free Thought Project, like I said, I just happened to stumble across this. I subscribed to her for many, 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 many years. This is a crazy, crazy, crazy thing going on. Dr. Mano, Pura Vida.